biggest challenge we face is actually getting people who are living with HIV but who are unaware of their status tested and into treatment. We have very effective treatments for HIV and for preventing full-blown AIDS. And yet, we have a lot of our hard-to-reach populations, like urban minority populations, who end up in the emergency room with an opportunistic infection and full-blown AIDS because they've never been tested and never been provided care. This really is the challenge of our generation. It's also the tragedy, though, that we live with today. There really is no reason we can't get these people into treatment and provide them effective care. And not only do we have a moral obligation to provide these people with care for their own health, but this really provides us the avenue for preventing secondary infection of HIV. You know, these days, that when we know for a fact that when people test positive and know their status, they're more likely to engage in less risky behavior. Furthermore, when people are being treated with antiretrovirals, they are actually less infectious. So by providing those treatments and getting those people into care, they're actually less infectious and less likely to transmit HIV. So it's really essential that we work to reach these populations, get people tested, and link them into care. The problem is that it is very difficult sometimes to reach people, and these are not always people who are already engaged in healthcare. So we really have to come up with innovative and creative outreach methods to reach people, get them tested, and get them into care. APT is honored to be carrying out one of CDC's largest projects targeting minority populations who are unaware of their HIV status, encouraging them to be tested, and linking those people who test positive into care and treatment. This project, the way this project runs is that we are working with community-based organizations across the U.S. in cities with the highest prevalence of HIV, and helping those community-based organizations develop more effective outreach methods for reaching persons who are living with HIV. This project is very complex, but it's very exciting for us because we are able to actually make an impact by targeting this challenge in HIV in the US today. It's sad that still 30 years after HIV has become a public health challenge globally, that we still deal with the idea of stigma around living with HIV. It's not only sad because it's a disease and it's something that we should be helping people address, but it's probably a contributor to why people aren't getting tested and why they aren't getting into care. One of the things that APT is doing that I'm so proud of and have been personally involved in is that we are a corporate sponsor and contributor to Metro Teenage, which is a local organization here in Washington that addresses the challenge of HIV in youth. We have a lot of youth in this city who are at risk for HIV infection and who are living with HIV. And we at APT have made contributions to this organization, helping them improve their programs and providing them important resources to expand the reach of the target of their programs. I actually have served on the board of directors of Metro Teenage and have actually recruited members of my staff to also be on the board of directors of Metro Teenage. So we don't just support this organization financially, but we also support this organization by our personal commitment.